Hey everyone, it's Dr. Erica Person with Flex Audiology, and today Stella's here with me as well. So if you see her down there sleeping, today we are going to talk about cognitive behavioral therapy and how that relates to tinnitus. So, what if I told you that how you think about your tinnitus can actually change how much it bothers you? Wouldn't that be amazing to change that? Tinnitus is not really just in your ears. There's very few people where tinnitus is actually in their ears. It's actually all up here in the brain. And that is exactly why cognitive behavioral therapy can be so powerful. In the interest of time, I'm going to shorten it to CBT. But what is CBT? It's a form of psychological therapy that helps identify and change negative thought patterns. So it's really not about curing your tinnitus, it's about managing your emotional response to it. So that also helps reduce your suffering. It helps reduce your anxiety, your stress, anything that just kind of makes you go, oh, like this when the tinnitus flares up. So how does it work for tinnitus? During a CBT treatment program, patients will learn how to recognize their negative thinking. So instead of saying, I can't live like this, or this is driving me crazy, I'm going to learn to say, I can learn to manage this. Or I can get to the point where I say, okay, this is happening. It happens every time I do X, Y, and Z. I know it's going to taper back down. And just simply by having that conversation, you are in control of the tinnitus, and you will learn to habituate and have it become softer. So CBT challenges any of the fear-based beliefs that you might have about tinnitus, and it helps you develop coping strategies and really kind of emotional resilience against the tinnitus. What does that lead to? It leads to being able to relax. It leads to having better stress management and better sleep hygiene. So what are realistic goals for a CBT training program? The number one thing is just realizing that CBT will not silence the tinnitus itself, but it does help reduce how annoying or how intrusive the sound becomes in your life. It helps you sleep better, and it helps you regain focus and enjoy your life a little bit more. The other great thing about CBT is that it's one of the most evidence-based treatments that are out there on the market today for tinnitus. And there's multiple clinical trials that show a significant improvement in the distress, anxiety, and depression that's related to having tinnitus. Now, why should you see a specialist? And when I say a specialist, I'm talking about either an actual psychologist who specializes in CBT, or specifically an audiologist that has been trained in audiology-based centered CBT, or CBT program that has been tailored specifically for tinnitus. And oftentimes you'll find an audiologist, either they can provide their own CBT program to you, or they'll collaborate with a professional in the area and refer you out to them. And there's definitely what we like to call best practices as far as it's related to a tinnitus-centered CBT. So it's unbelievably important that whoever you work with has been trained on this, they have the credentials for it, and it's not just somebody selling you hearing aids. I want to be super blunt about that. If you're going to a clinic that tells you that they do tinnitus treatment and their only option is tinnitus maskers through the use of hearing devices, I'm going to recommend that you check out some other places. These audiologists, these hearing healthcare providers, hearing aid dispensers, they do mean well, but they're confined to their knowledge base. So I would implore you to dig a little bit deeper about what the tinnitus training that provider that you pick ultimately has gone through. So what does a best practice look like in a tinnitus-centered CBT program? You will be doing specific questionnaires as it relates to tinnitus. They're quite lengthy, so be prepared for that. The audiologist may recommend hearing aids to treat the hearing loss itself, because oftentimes hearing loss can cause the tinnitus. It's the number one reason that people have tinnitus. And definitely look for the video that we can link here to get to that when I talk about that. And then really ideally, a practice should be looking at biomarker tracking. So what is the role of biomarker tracking, and what does it even look like? So it could be something as simple as an Apple Watch. It could be something as simple as a Fitbit. It could be something as simple as a ring. I've got two on because I just love technology. But when you're tracking your biomarkers, really what we're looking at is your stress levels, your heart rate, your cortisol levels, your sleep quality. I have another video that talks about sleep quality and tinnitus as well, so check that out. We want to track your movement, your exercise, really look at even your diet, looking at your something as simple as caffeine. I love me a good cup of coffee. This one happens to be the Funny Farm coffee cup. I love their company. I love their cup. But when I get to that third cup of coffee, that's when my tinnitus spikes. And so we're really going to look at your whole life, your whole body, really holistically. And all of those things can make tinnitus peak or make it worse. And we'll be able to track all of that for you. Now, where the CBT comes in is to help control your stress, your anxiety, potentially depression. We might want to look at a sleep program specifically for you. And the goal, again, is to decrease the emotional stress or de-stress or depression that the tinnitus is causing you. So I implore you that if your tinnitus is stressing you out or keeping you up at night, CBT may be the missing piece for you. Or even if you are someone who uses maskers, maybe you go to sleep and you have to have white noise on, or you've got to have the ocean, or you have to have the rain going. If that is you and you are still struggling to fall asleep, I would highly recommend you looking into some type of CBT program. If you haven't already, give us a like, hit subscribe, and that helps really spread the message to others so that others can get treatment. And if you have any questions, either drop them down below, or you definitely can feel free to reach out and we'll find someone local for you if it's not us. So hope you guys have a great day. Talk to you later.